So cancer-related fatigue is something that commonly occurs in patients during treatment. Up to 90% of cancer patients will experience fatigue over the course of their treatment, and for many of these people, this is an acute symptom. It's very disabling, can impact on their everyday lives, making it difficult for them to complete normal tasks. And for many, that will go away at the end of treatment, but for some that persists after treatment ends. So for about a quarter of people, they can experience this chronic persistent fatigue for many years post-treatment. There are a number of different things that people can do to manage the fatigue that they experience both during treatment and after treatment. Some of these things are getting some rest, having proper sleep hygiene, and eating healthy. But where the largest evidence base around strategies to address fatigue is in exercise. So it may seem a little counterintuitive for somebody who's very tired to think about getting up and being active and exercising. But actually exercise is the most beneficial thing to address fatigue. And for a lot of people, that can just start by a little bit of activity every day. So starting very moderate or low intensity exercise and building yourself up over the days. And as you do this, the evidence shows that your energy levels and feelings of vitality increase. So it is a very effective way to treat cancer-related fatigue. It doesn't really matter what type of exercise that you do, although the evidence does seem to show that aerobic exercise versus sort of strength training can be more effective. So if you want to walk, ride your bike, play a round of golf, do some gardening, any kind of activity like that can be effective. Ideally, you try to do this every day, and as I said, you can start out slow and slowly work your way up. It's great when you're starting out to talk to either your oncologist or your family doctor, and if you have an exercise program at your cancer center, to work with them to build an exercise prescription and to make sure that what you're doing is safe, and they can progressively work you towards what your goal will be. The guidelines for cancer survivors is that they work their way up to 150 minutes of exercise a week. And we know from the evidence, as I said, that this can be a very effective way to manage the fatigue that people have.